Good day, ma'am. I am Daniela Marie Gregory, and now I am going to demonstrate the blood pressure taking. Blood pressure taking is the pressure exerted on the walls of the arteries when the left ventricle pushes blood into the aorta. It is to determine the cardiovascular resistance to blood flow, to determine the effectiveness of cardiac muscle in pumping blood to overcome the vascular resistance. So the equipments needed are blood pressure apparatus, stethoscope, sphygmomanometer, paper and pen. So the first procedure is to identify and explain the procedure to the client to ensure that the right procedure is done to the right client and to gain the client's cooperation. Good day, ma'am. I am Daniela Marie Gregory, a student nurse from Notre Dame of College. May I know your name, please?
I am Larmaid Provito po.
I am going to take your blood pressure. Is that okay with you?
Yes po.
Thank you. Next is assess the client's physical condition to assess that the client is rested and to identify the affected side of the client. Next is to determine the baseline blood pressure of the client for comparison of results during monitoring. May I know, ma'am, when was the last time someone took your BP?
I don't remember po.
Thank you. So the next procedure is gather equipment to promote efficiency in healthcare providers. Next procedure is wash hands to prevent transmission of microorganisms. So the next procedure is assist the client in a comfortable position, sitting or lying. Place the arm at the level of the heart with the palm of the hand facing up, preferably use the left arm. This position places the brachial artery on the inner aspect of the elbow, which the stethoscope disc can rest on it conveniently. Having the arm above the level of the heart cause decrease in BP. Next procedure is wrap the deflated cuff around the upper arm, locate the brachial artery, place the center of the bladder over the artery. Then, for an adult, place the lower border of the cuff approximately 2.5 cm or 1 inch above antecubital space. Pressure applied directly on the artery gives the most accurate result. So the next procedure is to estimate the systolic pressure. Palpate the brachial artery, inflate the cuff, and note when the brachial artery disappears, deflate the cuff. Rationale to prevent underestimation of systolic pressure and overestimation of the diastolic pressure. So the next procedure is to wait for 1 to 2 minutes before further assessment to prevent false reading. And the next procedure is to place the stethoscope earpiece in the ears, close the screw valve on the air pump. Sounds are heard more clearly when the earpiece follows the direction of the ear canal. So the next procedure is to palpate the brachial artery. Palpate the brachial artery. Palpate the brachial artery. Turn the valve crosswise to stop and compress the valve to inflate to 30 millimeter of mercury above points where the pulse disappears to get accurate result. Next is next procedure is so the next is release the air slowly so that the pressure goes down at the rate of 2 to 3 millimeter of mercury per second to get accurate result. Next is when the final sound, rationale, release air slowly gives congestion in extremity, causing false reading. An air release too rapidly causes sounds not to be heard in the accurate level. So the next procedure is to release the air. Next is to listen to the sounds. The first muffling loud sound is the systolic pressure. Continue to release the air pressure even slowly and evenly. The last soft muffling sound is the diastolic pressure to get accurate result. So now we are going to wait for 1 to 2 minutes. So the next procedure is to roll the cuff and place it in the case, and then wipe the stethoscope using the antiseptic swab and out back to its proper place. This method of removing dirt prevents cross-infection of the ear.
Masakit. Hindi. Ayun po, nurse.
Then the next procedure is wash hands to reduce transmission of the microorganism. The next procedure is to evaluate the nature of the blood pressure. It is for comparison of the blood pressure baseline. And last procedure is to record the result taken for monitoring purposes. And that would be all. Thank you.